Over 5,000 pharmacists registered to supply drugs to public hospitals in the country on Friday threatened to cut supplies beginning 3rd of January 2017 if doctor strike is not addressed. Led by Pharmaceutical Society of Kenya Chairperson Mwaniki, they warned that subordinate staff that are currently administering medical care to the patients may not have sufficient knowledge of the drugs they dispense.
Even by distributing them or allowing them to leave your warehouse, to go to be handled by people who are not competent, or to lie in facilities where even there we don't know who is receiving them and storing them, it is an illegality under Cap 24.
Claims that the clinical officers see as demeaning to their professionalism.
We are competent enough, we have been trained well, and our services are up to quality. So you can go to the public hospitals and you'll be attended to. Whatever you are hearing from some other centers are just malicious attempts or a smear campaign to try and gain their political mileage.
The Kenya Union of Clinical Officers are demanding a public apology from the Pharmaceutical Society of Kenya for not recognizing their qualifications.
A duty we are not only lawfully allowed to perform as per Cap 260 law of Kenya, but also we have been doing so since 1928. We refuse to engage in simplistic inter-cadre wars at the expense of public. We demand an apology from one Paul Mwaniki, the pharmacist, failure of which we will sue him for defamation. He must understand that he cannot defame a whole professional and go scot-free.
The clinicians claim that 70% of normal operations in all hospitals across the country are made by their professionals and that they are certified under the law to administer medical care to patients even in absence of doctors.
Clinical officers have been trained fully. We have been existing in this country since 1928, before any other cadre. We cannot be intimidated. We are offering services to Kenyan. Our being at work doesn't mean that we cannot support the doctors. We support them, but we cannot support them at the expense of losing lives.
The union has since reassured Kenyans of quality service provision in all public hospitals amidst the doctors' nationwide industrial strife that enters its 4th week.
The services will include 1. All outpatient and inpatient services, clinics including TB clinic and HIV, all minor surgeries including surgical deliveries by reproductive health specialists, clinical officers, all specialist clinic including pediatric, reproductive health, chest and skin, ear, nose and throat, and ophthalmology, among others. We ask our fellow clinical officers not to be distracted by the malicious and smear campaign aimed at creating animosity between health workers who have been working in harmony for more than 5 decades.
Juni Karisa for Channel 1 News Weekend.
Forever, for the union makes us